There are troubling new details about a growing racial disparity in breast cancer-related deaths among women. The study found a widening racial gap in at least 39 of the most populous American cities. The results of that study suggest that African-American women are not getting the same access to screening, testing, and treatment as are white women. Let's bring in Dr. Dara Richardson-Heron, the CEO of YWCA USA. Dr. Richardson-Heron is herself a breast cancer survivor. So I want to start out by saying the study showed African-American are on average, American women are on average 40% less likely to die from the disease, more likely than white women. Why that disparity?
Well, you know, unfortunately, many African-American women do not have access to screening. And not only that, when they do get appropriate screening, they're often not given the same level and quality of care. And that's very, very disturbing.
Of course it is, but why on both of those things?
Well, you know, it's an interesting question, and certainly at the YWCA, we have focused for over 154 years on racial equity, health equity, and we've done everything we can to educate everyone that we can about those factors. But the reality is, it still exists, and it's very, very unfortunate. You're absolutely correct. Women, African-American women are far less likely to be diagnosed with breast cancer, but much more likely, 40% more likely to die of it.
Is it that preventative care and education for white women has gotten better somehow? And how could that be anyway?
Well, I'm not sure that that's the answer, but I think we know that African Americans are 55% less likely to have health insurance. That's why we at the YWCA are focusing on the Affordable Care Act. If you don't have access to screening, then you can't be diagnosed early. And if you're not diagnosed early, then unfortunately, the likelihood of you dying of breast cancer is much more common.
Does that mean there aren't enough clinics available to people without health insurance? And is there also a distrust among African-American women in the medical community?
Well, I think there is, and I think for good reason. And I think it's not so simple as to think, you know, it's just one thing. I think this is a system of health inequity that has been plaguing the African-American community for a long time. While this study is wonderful in that it looks at 20 years of data, the reality is we've known for many years that there have been severe disparities in healthcare amongst African-Americans, and not just because of lifestyle.
Well, this must be especially disturbing to you. You are a breast cancer survivor. You are an African-American doctor and part of the medical community.
Yeah, it's extremely disturbing, and really disturbing because I am a living testament to the fact that early detection and high-quality health care saves lives. And I really think, and certainly at the YWCA, we don't think that a woman should live or die from breast cancer just because of her socioeconomic status or her access to health education. That's why we have programs at the YWCA called Encore Plus programs that really focus on educating women and telling them about breast cancer health and preventive care.
Well, about 4% of doctors in the United States are black. That's only 4%. I want to read you some numbers. Of recent graduating classes, women are making up about 60% of new doctors. According to the American Medical Association, the number of African-American men heading to medical school is, though, dropping. So why do African-Americans continue to be underrepresented in your profession?
Well, you know, that's another, you know, multifactorial question. I mean, medical school is very, very expensive. And then often, you know, you have education, disparities in education that prevent and don't allow African Americans to get into the profession. But I don't think that's the issue. I think the issue is all doctors need to have appropriate level of training and make sure that African Americans get the same quality health care that their Caucasian counterparts get.
So in the meantime, if you are an African-American woman and you know that you haven't had a mammogram in 3 years, what are you supposed to do? Do you really, I mean, you obviously really have to seek out an opportunity for yourself if you don't have insurance provided and a doctor that you trust.
Well, you do, but that's, again, why we at the YWCA have really strongly supported the Affordable Care Act, because more women will have access. In the interim, also, women can go on the CDC website and find out places where they can get low-cost mammogram. The bottom line is you must be screened. The screening recommendations themselves are very confusing, but I will tell you from my personal experience, it's very important for women, particularly women 40 and over, to have a mammogram. It's not a perfect tool, but it's the best tool we have.
Dr. Dara Richardson-Heron from YWCA USA, thank you very much for joining us.
Thank you.
Congratulations on being a survivor.
Well, thank you. It's a pleasure to be here, and thank you for putting the story on the air.
You bet. Well, coming up, the next big thing on